Dr. Hal Gunn, CEO of Biologics. Thanks so much for listening in today on our panel discussion.
I'm Dr. Brian Bressler, gastroenterologist with the University of British Columbia. I'm the principal investigator for this current clinical trial.
And I'm Dr. Simon Sutcliffe, an oncologist and a chief medical officer for Biologics.
Over the last several years, there's growing evidence that what might underlie Crohn's disease is a defect or deficiency in the innate immune system, and specifically a cell in the innate immune system called macrophages. Macrophage means big eater, and an important role of macrophages is to clear dead and dying cells. If those cells aren't cleared properly, it creates inflammation, and there is an immune response involved in that inflammation. SSIs may work by stimulating a site-specific immune response of macrophages so that the macrophages come in and clear those dead and dying cells, and in doing so, clear up the inflammation that underlies Crohn's disease. Current treatments for Crohn's disease, like Remicade or Imuran or prednisone, work by suppressing that adaptive immune response and suppressing the immune response to that inflammation. SSIs work in a very different way by stimulating macrophage function and clearing up the dead or dying cells that underlie Crohn's disease.
So the approach to management of Crohn's disease is essentially to dampen down an inflammatory response and thereby relieve the symptoms. Historically, that's been done generally with anti-inflammatories or with steroids, and most recently with highly targeted drugs that actually interfere with functions of active lymphocytes involved in the inflammatory response. With SSIs, what we're really trying to do is reset the immune response, not dampen down the response per se, but reprogram it and reset it, an approach that's more directed to the underlying problem of Crohn's disease than the manifestations, which are controlled by controlling the inflammation.
SSI is administered with a simple subcutaneous injection, similar to when people inject themselves with insulin. It's typically given in the abdomen. It's given every second day, and the dosing of the SSI injection could potentially change based on a skin response that we sometimes see in patients on SSI therapy. For the trial, most patients will receive SSI therapy for 8 weeks. There are some patients, depending on which group they're in, that will receive it for 16 weeks.
QB-Echo SSI is made from E. coli. They're killed so they can't cause infection. But when we create an SSI from QB-Echo, we get a site-specific immune response, macrophage recruitment to the small and large bowel where E. coli typically causes infection. And as a result, we get an innate immune response to QB-Echo.
As we've mentioned, SSIs are given by subcutaneous injection, so the biologically active agent is present fairly soon after injection. However, it stimulates a chain of interactions between cells that involves cell migration, cell concentration in the organ in question, i.e. the bowel, and it is going to change the function of a number of those cells. So I think we can assume that it will take its activity over a period of maybe 7 days to 14 days before one would see some change. However, our experience would suggest that change can happen reasonably quickly within the first week or two, but we also believe that we have to give the drug for longer than that if we actually want to see permanent control as opposed to just a shift in an immediate response. And so our thinking, particularly in Crohn's disease, is that one may have to go out to a period of 4 months of treatment to be confident that the immune response will be reset in a way that will give rise to a good long-term response.
Prior to this larger trial, we treated 10 patients with Crohn's disease through a compassionate human use program. All 10 patients had moderate to severe Crohn's disease that was uncontrolled with standard therapy. All 10 patients had improved symptoms while on SSI treatment. 7 of those 10 patients had clinical remission while on SSI treatment, and 4 of those 10 patients are in sustained clinical remission after stopping all treatment, including SSI treatment. The longest sustained remission is now more than 3 years. That clinical use in those 10 patients wasn't part of a formal trial, so the obviously important next step is to do this formal phase 1/2 clinical trial that's now underway in Vancouver.
So the primary endpoint of this clinical trial is comparing the patients on SSI therapy to those on placebo therapy at week 8 with regards to a clinical meaningful response, which we've defined as a CDI of less than 100. Other secondary endpoints that we'll be evaluating, including the proportion of the two groups with regards to clinical remission. We'll be evaluating the CRP response of the two groups, and finally a fecal calprotectin response within the two groups at week 8. Patients that have not had a clinical response, which would be defined as a CDI change of 70, will then be offered the opportunity to receive open-label SSI therapy for an additional 8 weeks, and we'll be evaluating the response in that particular group as well.
We have information about SSI therapy from preclinical studies in animals for toxicology filing with regulatory authorities. We have observational data on patients receiving it for compassionate usage in Crohn's disease. We have experience on over 250 patients with cancer who've received SSIs. And of course, there is a much longer history in the use of killed cell vaccines in patients over the past several decades. What we anticipate is that there will be a local reaction, which is a pinkness or a reddening and induration of the skin at the site of the injection. Somewhat rarely, this can be sufficiently large to cause itching or some discomfort that's drawn to the attention of a patient. And very rarely, it can result in a fever, which resolves with aspirin. And so our cumulative experience suggests that this is a very safe, well-tolerated treatment, and we do not anticipate side effects more than the local reaction.
So this clinical trial is being conducted at only one site, which means that all participants will have to travel to our site, which is located in Vancouver, British Columbia, in Canada. And the site itself is my research office, which is the Gastrointestinal Research Institute, which is located in downtown Vancouver.
We have some preliminary clinical evidence of the value of SSI treatment for the treatment of cancer, as well as for the treatment of Crohn's disease, ulcerative colitis, and autoimmune arthritis. We've treated a wide variety of different advanced cancers through a compassionate human use program in Austria, and to date we've treated more than 270 patients in total with SSI treatment.
So the patient profile for this clinical trial would be patients who have moderate to severely active Crohn's disease. They're allowed to stay on their immunosuppressant agents if they're already on it, and low-dose prednisone can be continued as well. Patients, though, can't continue on their anti-TNF agents or be on any other biologic agents for management of their Crohn's disease while they participate in this clinical trial. So for this clinical trial, we have designed it so that 60 patients will be enrolled. As previously mentioned, 30 will be on placebo, 30 will be on active treatment, and at the end of 8 weeks, if patients haven't had a clinical response of greater than 70 points, then those patients, irrespective of what group they were in, will then be offered the opportunity to have open label SSI therapy for 8 weeks.